So we have a question, John, right off the top for you. It's quite clear that Africa is sliding into the second wave. This is a question from Caroline Mubaira, and she is interested in knowing what is being done now to learn lessons from the first wave to prevent deaths during the second wave. Are you able to respond to that question right away?
Can you hear me?
We can see you. We can see you there.
Can you hear me?
Yes, perfect.
Okay. Good. I think the reason I'm challenged a bit is that I'm in DRC and Kinshasa doing rounds of member states to continue to raise the alarm that a second wave is coming and we should prepare for it. I think that is, and the best time to do that is now. The fact is that we are better prepared today than we were 10 months ago. 10 months ago, in my presentation, we had nothing. We had no personal protective equipment, including masks. We had very limited diagnostics. We have all of that. Second is that we know the virus a little bit more than we did 10 months ago. So I think we should harness everything that we knew that we've learned over the last 11 months and apply it in respect to preparing for the second wave, which definitely some countries are witnessing it already, but as the entire continent, we are seeing that we are making a remarkable steady increases. So I think, the power of the community is very, very important. Community engagement, community leadership, and community ownership of the second wave will be very, very important. And lastly, the political leadership and coordination that was employed and deployed during the first wave has to continue. For just give you an example, the leadership of the continent, that is the Bureau of the Head of State, have had to listen to Africa CDC 8 times. They've convened the Africa CDC 8 times to listen to them with respect to where the pandemic is, where they should be heading to, what strategies to adopt. That momentum, that political momentum still has to continue as we envisage the second wave.
Thank you, John. I have one for you, Matthew, and this is a concern that the system of medical care worldwide is one of the hugest emitters. So can we figure out what we should be doing to actually encourage our health systems to reduce their footprint? We just lost your video, but hopefully you'll come back on. There you go.
Thanks, Kate. That's a very good question. And again, it's the health system leading by example. And there are some good examples of the health industry across the world trying to take leadership in this area. And for example, that's often converting from coal generators or for heating, etc. So I think there is a lot of scope for us taking the lead. Unfortunately, with all these things, it lands up some window dressing, and I think we need to be careful that those are real, authentic societal shifts. But John, I agree, Kate.
Thank you. I forgot to say that from Michelle Torlute, that question. And then, John, there was a real concern that's been raised in the chat here about access to vaccines. This is Duncan Quayetana, who's suggesting we should not leave any country behind. So what could be done given the no or limited funding in some countries to be able to hit the projected vaccine coverage targets?
So I fully agree. The African Union and the Africa CDC have been upfront with the need for the continent to have equitable access to vaccines. On June 24th and 25th, we convened a large meeting where about 3,000 participants attended a large conference, actually chaired by President Ramaphosa, the President of South Africa, in his capacity as the chair of the African Union. To really discuss issues around access to vaccines when they become available. We knew that this moment will come, the moment which means that vaccination will start soon in developed world, and we may actually be truly challenged in the developing world, and especially Africa. So we developed a strategic guidance, a strategic plan for access to vaccine on the continent. So clearly, as I showed in my presentation, the continent is working with the COVAX facility, which truly should be hailed, because that is a good example of global solidarity. That is a good example of multilateralism coming together and working together to address a common challenge. I always say that the Global Fund symbolizes the best of human beings in the world, when they all came together, pooled the resources, and said we have to use this to turn the tides against HIV/AIDS. I want to see this kind of efforts, this kind of fine minds and humankind that came together to establish the Global Fund, to apply that same thinking as we go out and look for vaccines against COVID-19. We, as a continent, are also looking at ways to leverage resources from within the continent through the Afro-Exim Bank, which is ready to put on the table $5 billion to enable Africa to access vaccines. I think we have seen the first two candidates, very promising results. If we were in the HIV world, we would be selected, because HIV has challenged us for 40 years. Until now, we don't have a vaccine of that nature. But we also know the challenges that the few vaccines that have been shown to be promising are still promising, because we are still dealing with an interim analysis. But the challenge of the delivery, I mean, there's vaccine, but there's vaccination, and there's no vaccination, no need to talk about vaccine if we cannot vaccinate. So I think as a continent, we will be challenged with delivery. Those vaccines require very stringent storage conditions of -70, -25 degrees across the continent. So we remain hopeful that the next generation of vaccines will continue to offer appropriate ways for distribution across the continent, so that we can actually have equitable and timely access to the populations that are in need.
Thank you, John. Matthew, a quick question. How likely is it, given that vectors are being influenced by climate change, that we're going to see a COVID-22, a COVID-24, some other pandemic, not 100 years from now, but in the near future?
I think that, Kate, that's a very interesting question, because as the vectors and other and human mobility, we'll get more, I think we'll get more mixing of different vectors as the geographical spread increases, with keep making areas more suitable for some vectors. So I think there is additional possibility of some crossover infections or other zoonotic infections. So I think that's a good question. And the way that humans still live, and our intrusion into nature, means that that new COVID kind of COVID infections are probably inevitable until we learn to respect nature.
So on the one hand, I mean, John has provided us, he's built my confidence. I'm really pleased to see, and I think everybody is, just how strong the response in Africa has been. And it's encouraging, John. On the other hand, Matthew has kind of destabilized us. He's made us think about things we haven't thought about before. So thank you, Matthew. Thank you both for your superb presentations. On behalf of my co-chair, Eli Katabirami, we'd like to thank you. I'd just like to remind everybody that the poster gallery is open all week. You can go and see posters. You can leave a question for anybody that you want to leave a question for. You can actually rate the posters if you want. And just to remind you, in these sessions, please use the chat in your screen, because you can pose questions to all of our presenters. So we're going to take a break now, a 15-minute break, and after the break, we're going to hear 4 of our top scoring 8 oral abstracts. Thank you, everybody.